Hello students, today we will discuss about the dural venous sinuses. In today's lecture we will discuss about the features of the dural venous sinus, the location of dural venous sinus and classification of these venous sinuses. Now before starting with the dural venous sinus, first we will discuss brief about the dural folds. In the last class I told you about the dural fold like falx cerebri, tentorium cerebelli, falx cerebelli. So when you will see the median section of your cranial cavity, inside the cranial cavity, after removing the brain, you are able to see a midline big fold, and this big fold is known as falx cerebri. Now this falx cerebri is present between the right and left cerebral hemisphere. When you will have the posterior part of the falx cerebri, you are having a horizontal fold. Now this horizontal fold is known as falx cerebelli, and this falx cerebelli divide the posterior cranial fossa into the supra and infratentorial compartment. In the infratentorial compartment in midline, you are able to see one more fold, and this small fold is known as falx cerebelli. What is that? Falx cerebelli. So in nutshell, before reading the dural venous sinuses, you should have the idea about the dural folds, because the basic thing of the dural venous sinus is that they present in these dural folds only. Now what are the characteristic feature of the dural venous sinuses? So the first important thing about the dural venous sinus, that the dural venous sinus is a network of venous channel that drains or collects the CSF and blood. What is the function of dural venous sinus? That it collects the CSF and blood coming from the brain, the venous blood of the meninges and the cranial bones. Clear? These venous sinuses lies between the endosteal and meningeal layer. This is the question which is important to understand, and the important and most conceptual thing is that except the two dural venous sinus, inferior sagittal sinus and the straight sinus, which does not present between the endosteal and meningeal layer of dura mater. What does it mean? Now in this diagram you have to understand that this green color line is your meningeal layer of dura. Now this green line is invaginating between these two parts of the cerebrum. This is your endosteal layer, and at the point of reflection or at the point of separation between these two layers of the dura mater, this blue color area is present, which is your dural venous sinus. So the conceptual thing is that dural venous sinus present at the places where you have the separation of endosteal layer and meningeal layer of dura mater. But there are two exceptions. First exception is inferior sagittal sinus, second exception is straight sinus. Why they are exception? Because when you will see the section of this falx cerebri, at the lower end of the falx cerebri you have the inferior sagittal sinus, and this fold is purely made up of meningeal dura mater. That's why it is not having the placement like the other sinuses between the endosteal and meningeal dura. Clear? So यहाँ पे ये बात आप सबको याद रखनी है. You have to keep this thing in your mind that most of the dural venous sinuses lies between the endosteal and meningeal layer of the dura mater, except the inferior sagittal sinus, because the lower part of the inferior sagittal sinus, which is present here in this area, here you have the sinus that is known as inferior sagittal sinus, and here you have the sinus that is known as the straight sinus. Now these both sinuses are present between the fold of meningeal dura, not between the endosteal layer or endosteal layer and meningeal layer. The sinuses are lined by endothelium. Now this is the common thing about any venous channel. Even though if you will see a normal vein, the vein is lined on inner side by the simple squamous epithelium, and the simple squamous epithelium is named as endothelium. So this endothelium is also present in the venous sinuses. But the question is that they are devoid of any kind of the valve. Their wall does not have any muscle, so they are devoid of the muscular tissue. As you have a classical vein, you have the tunica media. Tunica media is made up of a smooth muscle. But when we will see the veins, that is actually the dural venous sinus in the cranial cavity, it is not having any kind of the valves, and the wall is not having any kind of the muscle. Now there is one more example where you don't have the muscle in the vein, and that is known as maternal placental veins, the maternal placental vein. Clear? Several of them have important communicating branches which are known as emissary vein with veins outside the skull. It helps to keep the pressure of brain in the sinus constant. Clear? So what are the important features you should know about the dural venous sinus? Dural venous sinus receives the blood from the brain and also CSF. They are present between the endosteal layer of dura and meningeal layer of dura, except the two sinus, inferior sagittal sinus and straight sinus. They are lined by the endothelium, but they does not have the valves. Their wall does not have any kind of the muscle. There are connection of these dural venous sinuses outside the brain with the help of emissary veins. Now the next thing is the classification. On the basis of their presence they are classified. If they are midline sinuses, they are unpaired sinuses. If they are present in both right and left half, then they are known as paired sinuses. So this is the list where you have the unpaired sinuses are superior sagittal and inferior sagittal. They are present in the sagittal plane along the superior inferior border of the falx cerebri. Straight sinus, it is at the junction of your posterior end of the falx cerebri with the superior surface of tentorium cerebelli. Occipital sinus is present into the infratentorial compartment along the falx cerebelli. Then you will have the basilar venous plexus and intercavernous sinuses. Those are connecting the cavernous sinus. Now what are the paired sinus? Those are present in both right and left cerebral part of the cranial cavity. Cavernous sinus, superior inferior petrosal sinus, transverse sinus, sigmoid sinus, sphenoparietal and petrosquamous sinus. Now we will see the overall location and their positioning inside the cranial cavity. We are not discussing each and every sinus in detail, that will take in the coming classes, but today we should understand the positioning of each and every sinus. So the first is superior sagittal sinus. So it usually empties into the right transverse sinus on the right side of internal occipital protuberance. What is the location of superior sagittal sinus? When you will see the fold of the dura, that is known as falx cerebri, along this superior border you have the sinus, and this sinus is known as superior sagittal sinus. Now in this picture you can see that this is your superior sagittal sinus. Now this superior sagittal sinus is present along the inner side of your skull. When you will open the cap, inside the cap you are able to see the groove. That groove is known as sulcus for superior sagittal sinus. So here you can see that this is the positioning of superior sagittal sinus. Now this superior sagittal sinus present just below the sagittal sulcus, or you can say sagittal suture, and this sinus is continuing on the right side, and this is a horizontally placed sinus. This is known as transverse sinus. So there are two things you have to understand here in this slide of the superior sagittal sinus, that this sinus is present along the upper border of the falx cerebri, and then when it reaches to the posterior side, it turn right side. And this continuation on the right side of this superior sagittal sinus is known as, this part is known as right transverse sinus. This part is known as right transverse sinus. Then this is the cut section. Now after removing the cap, if you will cut the dura mater, you are able to see in the whole length the presence of superior sagittal sinus, which is broader in the posterior part as compared to anteriorly, and this sinus here you can see that it is receiving the cerebral veins or the veins of cortex. That's why they are known as cortical veins. Now what is the position of inferior sagittal sinus? If you follow the inferior sagittal sinus, posteriorly this inferior sagittal sinus at the site of the junction with the straight sinus, where you will find what will happen with the inferior sagittal sinus, it will continue with the straight sinus. We will see all the position in the coming diagram. Then we have the straight sinus. The straight sinus extends posteriorly along the junction of the falx cerebri and the tentorium cerebelli, which I told you in the first slide. It flows most often into the left transverse sinus, where it will continue in the left transverse sinus. If in the floor of the posterior fossa you will find a curved sinus, that is known as sigmoid sinus. It is the extension of the transverse sinus and terminates at the jugular foramen. So what is the relation? Now superior sagittal sinus. Superior sagittal sinus continue as a right transverse sinus. Right transverse sinus continue as a right sigmoid sinus. The right sigmoid sinus ultimately continue as a internal jugular vein, comes out as a internal jugular vein, while inferior sagittal sinus join with the straight sinus. The inferior sagittal sinus joins with the straight sinus. Straight sinus form the left transverse sinus. Straight sinus form the left transverse sinus. The left transverse sinus form the left sigmoid sinus, and the left sigmoid sinus then form the left side jugular vein. Clear? So this should be very clear in your mind when you are seeing the right and left internal jugular vein. Internal jugular veins are continuation of respective side sigmoid sinuses. But the right sigmoid sinus is continuation of the right transverse sinus. Left is a continuation of left transverse sinus. Left transverse sinus is a continuation of straight sinus, while the right transverse sinus is a continuation of superior sagittal sinus, while the straight sinus receives the inferior sagittal sinus. So in this list, this straight sinus is a additional name which you have to keep in mind, which is not in this part. So in this diagram now we will see each and every sinus. So first is the superior sagittal sinus. So superior sagittal sinus is here. Now this superior sagittal sinus is along the upper border of the falx cerebri. Along the lower border you have this inferior sagittal sinus. Now this inferior sagittal sinus then continue as a straight sinus. So this is the straight sinus. Now where is the straight sinus present? At the junction of posterior end of the falx cerebri and the superior surface of tentorium cerebelli. And this is inferior sagittal sinus, which is actually open into this straight sinus. Now this straight sinus continue on the left side as a left transverse sinus, while this superior sagittal sinus continue on the right side as a right transverse sinus. Now in this diagram you can see that we have take out the whole dura mater, and in this fold of the falx cerebri you can see that this is the superior and inferior sagittal sinuses. Now in this diagram you can see that this is more clear, the inferior sagittal sinus. This is the location of straight sinus. Now this is the location of superior sagittal sinus, and this superior sagittal sinus continue on the right side as a right transverse sinus. So it will continue as a right transverse sinus. This transverse sinus continue as a sigmoid sinus. Sigmoid means the S-shaped sinus. So this part is known as sigmoid sinus, and then it will come out as a internal jugular vein. So you should keep in mind about the superior inferior sagittal sinus. You have to keep in mind about the straight sinus, right and left transverse sinus, and the sigmoid sinus, which are actually present in the lower part in infratentorial compartment. Now we will see the superior petrosal sinus. Now in this diagram, if you will see that this is the petrous part of the temporal bone. Now this is known as superior border of the petrous part of temporal bone. Now along the superior border of the petrous part of the temporal bone, you have the superior petrosal sinus. So superior petrosal sinus present along the superior border of the petrous part of temporal bone. So this is known as, this sinus is known as superior petrosal sinus. It extends from the lateral aspect of the body of sphenoid bone at the cavernous sinus and course laterally and posteriorly it will reach to the transverse sinus. So in this diagram, if you will see that where is the cavernous sinus. So this is the cavernous sinus. This is the one side, this is the another side. It is a paired sinus. Now from the posterior part of the cavernous sinus, you have the continuation posteriorly, and this continuation is known as superior petrosal sinus. On the other side, you can see that this is your transverse sinus, and this transverse sinus is going downward as a sigmoid sinus, and this is the exit through the jugular foramen. Now this sinus is joining the transverse sinus here. So which sinus is this? Superior petrosal sinus. Which sinus is this? Sigmoid sinus. Which sinus is this? Transverse sinus. So your superior petrosal sinus is arising from the cavernous sinus. It is going posteriorly, then it is joining the transverse sinus where it will continue as a sigmoid sinus. Clear? So you are able to understand the position of superior sagittal sinus, inferior sagittal sinus, transverse sinuses and sigmoid sinuses. So transverse sinuses are present here on both the sides, posteriorly on inner aspect of your occipital bone. Now where is the cavernous sinus? I just told you that cavernous sinus is a paired sinus, and this cavernous sinus present on both the side of the body of sphenoid, and these cavernous sinus are connected by intercavernous sinus. They are connected by intercavernous sinus, and there is a two sinus. One is known as anterior intercavernous sinus, one is known as posterior intercavernous sinus. So this is the another important thing, that cavernous sinus is a paired sinus, but intercavernous sinus is a unpaired sinus, and they cross the midline. So this is the right and this is the left cavernous sinus, and they are connected by anterior and posterior intercavernous sinus. So these are the unpaired structure, but these are the paired structure. Clear? Then this is the question of your exam or your viva. What is the confluence of venous sinuses? Confluence of dural venous sinuses. It is also known as torcular herophili. It is also known as torcular herophili, or it is known as confluence of dural venous sinuses. Now the first question where you will find this confluence, answer is inside the cranial cavity near the internal occipital protuberance. Near the internal occipital protuberance, and this point is known as enion. This point on outer surface is known as enion. So this point where you will have outside external occipital protuberance, and at the same point inside you have internal occipital protuberance, and this protuberance is known as enion. At this point you have confluence. Now confluence means the meeting of the sinuses. So which sinuses are meeting at this point? Superior sagittal sinus. So this is the superior sagittal sinus which is reaching here. Then straight sinus. Straight sinus, we have seen that it is present here, and this sinus is also reaching here. Then you will have occipital sinus. Occipital sinus present in the lower part in the infratentorial compartment, and that will also approach this point, and the transverse sinuses. So these are the transverse sinuses. Those will arise and go on right and left side. So when you will see this point, now this point is known as confluence of sinuses, and this confluence of sinus is a meeting point of superior sagittal sinus, straight sinus, occipital sinus, and right and left transverse sinuses. Clear? Now, in this diagram, this is your external occipital protuberance. Inside that you will have internal occipital protuberance. Outside this point is known as enion. Now, just inside this area is known as confluence of sinuses. This area is known as confluence of sinuses. Now, which sinuses are meeting here? If you will see in this diagram, this is the superior sagittal which is approaching. This is the straight sinus which is approaching. This is the occipital sinus which is approaching. And this is the point where the transverse sinus is arising and going transversely on the inner side horizontally. Clear? It is not going anteriorly, it is going laterally along the occipital bone. Then in this diagram also you can very well appreciate how this inferior sagittal sinus continue with the straight sinus and how this superior sagittal sinus and occipital sinus all are approaching this point, and that is known as confluence. And here also you can see that this right transverse sinus which is present here comes out and it is then continue downward as your sigmoid sinus. And I told you that at the junction of sigmoid sinus and transverse sinus it is receiving the superior petrosal sinus. It is receiving superior petrosal sinus which is present here. The position of the lower border of the proximal transverse sinus. Now see, the word is proximal. Transverse sinus is best approximate via the insertion of semisplanus capitis into the cranium. What does it mean? That if I want to do the surface marking of the proximal transverse sinus, I have to mark first the attachment of semisplanus capitis. Now this is your semisplanus capitis muscle. You can see that this is your semisplanus capitis muscle. Now this is the point of insertion of the semisplanus capitis. Clear? So if I want to mark the transverse sinus starts from this confluence on the inner side. One is going on the right side, one is going on the left side, and this proximal part of the transverse sinus is marked by the attachment of this muscle is known as semisplanus capitis. The second thing is the course of the transverse sinus is highly variable, so no single surface marking is used to predict the accurate route. With the help of this, you can have just the idea in the exam or when you are examining the patient, but it is not 100% accurate because the transverse sinus is variable in the width. The another important thing is that at what point the junction of transverse sinus and sigmoid sinus present. Because transverse sinus is like this and sigmoid sinus which starts from the confluence and then there is a turn. Now this turn on the inner side is marked by the outer point is known as asterion. Asterion is a junction of lambdoid suture, occipitomastoid suture and paritomastoid suture, and the asterion sits over the junction between the transverse sinus and sigmoid sinus. So this is very commonly asked question for your exam. It is a 5-star question. So again, if you will see this picture, and my question is mark the transverse sinus. So this is the transverse sinus. How you are able to mark this? By the line of attachment of semisplanus capitis, which is just deep to the trapezius muscle. Now in this diagram you can see that this is the point of asterion. So this is the asterion. Now in this asterion point, which are the meeting, so there are, it is a star shaped suture. You can see it is a star shaped suture, and this is your parietal bone, this is your lambdoid suture, this is occipital bone, and this is the mastoid part. Now in between you have this asterion. Now asterion is the point. After that you have the sigmoid sinus, and before that you have the transverse sinus. So when you will see a living person, this asterion is a junction where this transverse sinus continue with the sigmoid sinus. Clear? So how to mark the junction of sigmoid and this transverse sinus? With the help of asterion, the clinical importance of asterion. Now in this diagram also you can appreciate very well that this is your superior petrosal sinus and this is your transverse sinus. See, this is your transverse sinus. Now this transverse sinus is continue downward as sigmoid sinus. Now this is the point which lies inside your asterion, and at the same point the superior petrosal sinus will join the transverse sinus. And this is the transverse sinus of the right side, and this right side transverse sinus is a continuation of superior sagittal sinus, while this straight sinus turn on the left and continue as a left transverse sinus. So these are some questions for your exam. Straight sinus located where? So it is at the junction of posterior end of the falx cerebri with the superior surface of tentorium cerebelli. The straight sinus continue as a left transverse sinus. Left transverse sinus continue as a left sigmoid sinus, while the superior sagittal sinus will continue as a right sigmoid sinus, right transverse sinus then continue as a right sigmoid sinus, and it will come out through this foramen, that is known as jugular foramen or jugular canal. The important thing again I will tell you that the junction of the transverse sinus and sigmoid sinus on external surface marked by asterion. Clear? Now in this diagram we have removed the whole dura mater. So now you can see the cut part of the different sinuses. So first we will mark the jugular canal. So this is the jugular canal from where the internal jugular vein starts. So this is the first thing which you have to understand, that your sigmoid sinuses comes out from the cranial cavity and you have the commencement or starting point of internal jugular vein. These sinuses are receiving the transverse sinus. So this is the transverse sinus of the left side, this is the transverse sinus of right side. This transverse sinus is receiving the superior petrosal sinus. These are the anterior posterior cavernous sinus. These cavernous sinus are draining through the superior petrosal sinus into the respective side of transverse sinus, and ultimately whatever the venous blood is present in the transverse sinuses will reach to the internal jugular vein through the sigmoid sinuses. Clear? So at the end of this lecture, I hope you are able to understand the positioning of different dural venous sinuses, how the internal jugular vein form, how the superior sagittal sinus continue posteriorly as a transverse sinus continue as a sigmoid sinus, and ultimately the sigmoid sinus form the internal jugular vein. So this is all about today's class. Thank you.